Hi everyone, my name's Janelle. I'm a functional nutritionist who lives and plays in the Sierra Mountains, and this is my podcast where we talk about functional health with a mountain twist in 30 minutes or less. Today, I'm talking with my brilliant friend, Brianna Browning. Brianna is a doctor of Chinese medicine and a certified functional medicine provider. She specializes in women's health, digestion, and fertility. Her practice integrates science with ancient wisdom and an education-forward approach. Today, we're discussing the importance of digestion and the surprising ways stress impacts it. I loved our discussion, and I hope you do too. Welcome, everyone, and welcome, Brianna. I have been looking forward to this conversation with you for a while, and I'm super grateful you're here. But the two of us have worked together in a few different ways, and no matter what we're doing together, you have an ability to show up with this incredible calmness and groundedness and wisdom that I really appreciate. And it's super admirable. It's a gift to your clients, it's a gift to your colleagues. So thank you so much for that. And thank you for being here to discuss stress and digestion. So
Well,
thank you.
thank you, Janelle. I feel very seen, so I appreciate that. And thanks for
Oh,
having me here. It's my pleasure.
good. Great. Thank you. So, okay, Brianna, we both work functionally. And one of the pillars of functional thinking is being curious about what's driving symptoms and disease states. And when we do think that way, it's really amazing how many times the problem originates in the digestive system.
Oh yeah.
Right? So, but super curiously, only sometimes do the symptoms actually show up in the digestive system. So I would love if you wouldn't mind starting off speaking into that, how some symptoms can be acute in the digestive system and some are other places in the body.
Yeah, well, I think really just starting with like what our digestive system is. If you think about, I like to think of our digestive tract as like our roots network. Kind of like if you think about in a forest, how all of the trees have this root system. That is our digestive tract. And what they're doing is they're pulling fluids and they're pulling minerals and nutrients from the soil, microbes up from the soil. It's our communication with the world around us. And so that's what our digestive tract is doing. It's like our direct connection to the world around us and how we pull in all of these microbes and nutrition and fluids, and it's our gateway to our bloodstream, right? So we have like this giant organ system, this multi-organ system that communicates with the world around us and can directly, whatever we're putting into it, move into our bloodstream. And so it can get really complicated when we're having these symptoms. And, I always tell clients that they're kind of the lucky ones if they can directly correlate, something they're eating with discomfort, right? It's like it's easy to know if, okay, I have this piece of toast and then I get a stomach ache, direct correlation, but it's not always like that because when we have, this direct access to the bloodstream, that means that really symptoms can occur anywhere in our body and our digestive tract, what's going on in there can impact every single system, our brain, our hormones, our liver, our skin, and so it's not just, the food we're eating and the nutrients we're getting, which is important, because it's our ingredients, but it's also, where over 70% of our immune system is. And so any type of inflammatory response that's happening in the digestive tract can also happen systemically. And so, back to your question, it's like, yes, you can have these acute symptoms that are occurring in your digestive tract, like bloating or acid reflux or, gas, whatever it is. And
Constipation, diarrhea, all the
sure,
things.
I mean, it's like the list goes on, right?
Yeah, yeah.
And so it's like, we correlate those directly with digestive health. But oftentimes we can have these kind of sneaker symptoms, that go on, whether maybe it's skin rashes or headaches. Maybe we're just always fatigued or wake up puffy, achy joints. And a lot of times we don't connect digestion right off the bat, or at least our thought process. Um, But oftentimes, when you kind of dig a little bit deeper into the digestive tract, oftentimes we can find a root cause there, or at least one of the roots, right?
Mhm. Mhm. Yeah, yeah, really good points. So many good points. That last one being really important, multiple roots. There
Yeah,
isn't usually ever, God bless the person that has one root
I
that's
know.
driving problems. But yes, there's always multiple roots. And I really love what you said about the digestive system really being the intersection between everything in the outside world, including food, and what is allowed inside of our body. So, yeah, that was absolutely brilliant. Thank
Yeah.
you. So, yeah, so thank you for talking into that. And then, okay, so so we know the digestive system is really important when we're talking about all the different kinds of health. But if we look upstream of the
Mhm.
digestive system, even, I so often find, and I know you do too, that it's the nervous system
Yeah,
that is really impacting our digestive system and how our digestive system is functioning and interacting with the world. So, if it's okay with you, can we move into how, I mean, this is such a big question, but
let's go there.
how, let's go there. These are two huge topics, but
Mhm.
how the nervous system can impact the digestive system. And we don't need to cover every single one because there's so many. We could sit here for, the whole day and discuss
Yeah,
this, but, just what are some of the ways that our nervous system, our stress response can impact the digestive system and everything that's downstream of that?
sure. Yeah, I mean, I think it's really important to recognize that digestion doesn't start with food, right? Digestion actually starts in the brain. It starts before food is even in our body. And so, I like how you say upstream because that's so important when we're talking about digestion because it is a north to south process. And so when we think about, just some basic, anatomy, physiology of our nervous system, it has two wings to it. There's this sympathetic side, which is very much our like fight, flight, stress response. And then there's the other wing that is our parasympathetic, and that is very much rest, digest,
Mhm.
and, reproduce and repair. And so we literally cannot digest food unless we are in that parasympathetic nervous system. And so that's often, step one where the breakdown occurs. It's like, are you sitting down to have a meal at rest? Or are you, eating at your office desk while working or eating in the car or eating while, you're getting your kids ready for school where your digestive tract doesn't even get the signal that digestion needs to begin. And so oftentimes, that is step one, that is often the breakdown. But it goes, beyond that, right? It's like if we are not in that parasympathetic, that rest and digest nervous system, then our mouth doesn't make saliva. Our stomach doesn't make stomach acid. It doesn't get the signal for digestive enzymes to get made or bile to get released. Even like our blood will leave our digestive tract if we're in a stress response. It goes to our heart to beat faster and our eyes so we can see more clearly and like run away from danger, literally. And so, step one, we always need to at least recognize if we are in a stress state when we're eating food so that we can do something about it. And then it's like, moving down from the brain or still involving the brain, our digestive processes, it's a sensory experience. Right? We need to be engaging all of our senses with food. We need to be smelling our food. We need to, touch our food, like maybe not use utensils so much. It's like really looking at our food and just engaging with it so that our brain can get all these signals and so that our nervous system can actually relax and like enjoy the food we're about to have, slowing things down a little bit. So, really, it's like our nervous system is step one with digestion. And I think it's probably the most neglected piece after all, overall.
I totally agree with that. I work with so many people who are eating such great food, they're moving their body, they're doing so many things right, but stress is definitely the elephant in the room. And we all know that we should, reduce the stress in our life and have a mindfulness practice. But it's almost so cliche that it's overlooked, I find. I mean, it's so
Yes.
weird. But when you really break it down like this to a cellular level at how much stress impacts our body and digestion, it's really just mind-blowing. And I love what you were saying about digestion starts in the brain. We need to be in that parasympathetic state to have our digestive secretions, enzymes, bile, stomach acid, all of those things, and even motility.
Motility, movement.
Yeah, motility. If we are super stressed, things can pass through really quickly. And then what you were talking about earlier, the interaction between the world and our digestive system, then there's no interaction. It's just passing through too quickly. We can't break it down.
Yeah, it's like it's a double whammy, right, with stress because not only does stress impair our ability to absorb our nutrition and get all those nutrients, but stress also rapidly depletes our nutrients at the same time.
Right.
So we're really getting like hit from both sides where it's like all of our minerals start getting depleted and then we also aren't absorbing new ones. And so it sets us up for, a systemic impact where we don't even have the ingredients that our body needs to function, right?
Yeah, I really had my mind blown recently. I was reading a study. It was actually, of course, by Karen Krishnan, our favorite microbiologist.
Yep.
But it was about how much just the stress response alone impacts the microbiome.
Oh
Uh,
yeah.
if nothing else, even if we're digesting and breaking down, just the impact of our microbiome and really depleting our good, healthy microbes that we need for another overwhelming topic, everything. Our
Oh
brain,
yeah.
our heart, our hormones, our bones, our toxins, like everything. And then those opportunistic microbes really can grow and cause a problem and all that. So,
Yeah. And it's so challenging because I feel like a lot of times people don't even realize how stressed they are. It's
mm.
become so commonplace just in our modern go, go, go society that, you ask people about their stress levels. They're like, oh, fine. And it's like, and then you really start digging a little deeper and they just list all the things they have going on in their life. And I'm like, oh my gosh, like that's a lot. Like we need to recognize this.
Or my
Right.
favorite one is I have normal stress.
I'm like, what does that mean?
What does that mean? What is this
Normal
normal
stress means like
stress?
acutely goes up and then comes back down. It's not this constant low grade stress all the time that we're experiencing in our lives, all of us.
Well, I think that's a really good point that our stress response is this wonderful response that we have depended on to stay alive, right, for thousands and thousands of
Yeah.
years. But only up until, I mean, what do you think, 200 years ago? So, not that long ago, maybe even
Nope.
100, even less 50 years ago with all of technology. But we were doing exactly what you just said. We were having our stress response. It was coming back to baseline and we were repairing and recovering and sleeping and all that. But now our stress response is up, elevated all the
Yeah.
time, even when we don't even realize it.
It's like this evolutionary mismatch, right? Where it's like our stress response, our own physiology hasn't really evolved at the pace that we are at today in our modern environment. Our environment is changing a lot quicker than our genetic code can, right?
Oh yeah, that is such a brilliant point, and of course a brilliant phrase. I love that. Our world is changing so fast and our
Oh, yeah.
biology is not. Our biology is it's hundreds thousands of years old. So that's a good point. Let's talk about, I think it'd be a great time to talk about what is stress. I mean, not like what makes us stressed, but I think what you said, people don't actually realize they're stressed. Yes, we have emotional stress. That
Sure.
is so big and so important, and that could be enough alone. But stress comes from other things also, right?
Yeah, there's a lot
When,
of things that can fill up the stress bucket, right?
yes, thank you. Brilliant. Okay, let's talk about that. What are a few of them
Yeah.
that you see?
Well, I mean, of course, emotional stress and just like life situation stress, that's, it's a big thing. But, stress comes in many forms. Stress can be physical, even an injury, that's an easy form of stress. If we are eating foods with, plastics or food dyes or, chemicals in them that our immune system is confused by, that also is another form of stress on the body. Um, if we are, let's say, not getting enough sleep, our
Mhm.
body doesn't get to do its repair.
Really
That's a
big.
form of stress too, and so we have to really dig deeper. And I think like when just asking that question, what are your stress levels? It's not really, it's pretty surface level, right? It's like we really have to, people need to understand that stress comes from so many different things before we can really evaluate like what is your allostatic load, right?
Yes, brilliant. So you mentioned emotional stress, which is obviously very real. We're not saying that anyone needs to go without emotional stress, but that's one. Physical injury, you mentioned another really big one. And kind of along with that is over exercising,
Sure.
because hard cardio really does elevate our stress response. So when we're doing that day after day after day, that
Yeah.
accumulates, right, in our stress bucket, depending how everything else is. Nutrient deficiencies. I mean, so
Sure.
many things. You said toxins. You
Environmental
said you
stress.
said poor sleep. Yeah. I mean, blood
Blood sugar.
sugar.
Yeah. I mean, you could even take it farther where it's just like, not feeling like you're on your life path. That's a form of stress too. Or maybe,
Mm,
it's beyond just like, I don't like my job, but like what am I doing with my life? Like these like really like big questions can weigh on people where if you don't feel like you are, you know, fulfilling your own passions, it's like that is stress on the body, right?
right. Such a big topic because
I know.
a as we said, digestion impacts everything, stress impacts everything. So, what do you think people can do? I mean, what are, I don't know, 3 things maybe or whatever you think that people can do to improve specifically this topic? So,
Yeah.
stress and then how that impacts our digestion and everything downstream of that.
Sure. I mean, I think the first thing that's probably the simplest that we can do is just to create a 1-minute ritual before our meals, and
Mm.
really like make this into a sustainable habit. And it doesn't have to be complicated. Just spending 1 minute where you are sitting with your food and doing some deep belly breathing, just rhythmic, deep breaths where you're actually moving your belly out, and it's like that, even just rhythmic movement, it's like your diaphragm that's massaging your digestive tract, but it's also activating your vagus nerve. And your vagus nerve is the gateway to that parasympathetic rest and digest. And so, if you can just do 1 minute of rhythmic breathing before your meals, it can get you into that rest and digest parasympathetic nervous system. And it's like you can even pair it with gratitude. You could use that time to really like just stare at your food for a minute and like look at the colors, look at the textures. All of these things is like engaging your nervous system to tell your body that food is coming in so that you get all the gastric juices that you need and motility happens. So it's so simple. It doesn't have to be complicated.
I
Um,
love this. Wait, I just love this so much
yeah.
because it's free.
Yeah.
It costs nothing. You can do it at your next meal. You can do it
Every meal.
at every
Yeah.
meal. I just mean like you don't have to wait for something to come in the mail.
Sure.
Like you can
You don't have to
start
test
right
for it. You
now.
don't have to,
You don't have to
you don't have
test.
to take
There's
a
no
supplement.
lab work. And it is such an upstream issue and it is going to impact so much. That one habit that
Yeah.
you can do at every meal and snack is brilliant. I love it. So that's amazing. Thank you
Yeah.
for that.
So, so simple. But harder than you think to actually like do it, or
Well,
to
because I
really.
think it seems so simple. People
Mhm.
don't think it could be that big, but
Yeah.
yeah, brilliant. I love it. Okay.
The other thing I think is important that's often neglected is, just being mindful of the story that we're communicating, like your thoughts while you're having food.
Mhm.
There is some really interesting research out there that goes into how much your perception of the food impacts your metabolism of it more so than the food itself. Have you seen some of these studies about?
I actually haven't.
Yeah, I'll
This
have
is
to send
I
them your
love
way.
it. Mhm.
Yeah, it's where they take this group of people and they give them this meal that is very low glycemic, so, like, no sugar in it, pretty, like, healthy meal, but they disguise it and they tell them that it is full of sugar, it's dessert, it's
Mm.
you're gonna love it, and every single one of them, they measured their blood sugar and they spiked.
I
Their
love
blood
it.
sugar, even, like, without having sugar in it, it was,
They
like,
were
a very
stressed out.
they
They
were
were
stressed
stressed.
about it,
And
and
when we stress,
stress
cortisol is
raises your
gonna
blood sugar.
spike,
Yeah, exactly.
and then blood
And
sugar.
so
Wow, that
yeah,
is
so I was
so
just like,
cool.
like mind blown. Okay, so think about like, what that means, the story that we're telling as we are eating our food. It's like even if you are, maybe like going outside your ideal nutrition for that meal, don't attach shame to it and, fear of it. We really need to at least sit with it, slowly eat it, chew our food, get into a relaxed state so that we're not going to have as big of a reaction. There's even other research that shows that you're like when you show gratitude while you're eating, you actually absorb more nutrition from that food. And so really just being mindful of like the story that you are connecting with that meal can be so, so helpful. Definitely upstream
Mm.
and free again.
And free again,
Right?
and you can do it right away, and it really
Mhm.
does have a huge impact at a cellular level. I
Yeah.
love that, and people become so hypersensitive and hyper scared about food these days because we hear so much about how foods are bad for us and so I get a lot of people scared of food, and I love this because if you're gonna eat it, just have a positive story around it and bring that calm. I This is brilliant. So
Yeah.
and what you said about gratitude, and I teach that that stimulates oxytocin, and oxytocin combats cortisol,
Yeah.
and that provides a better opportunity for digestion. So, um, I love that one. So number 1 and 2 are really huge. If you stop there,
Mhm.
I would be grateful, but do you
Uh,
have another one?
I do.
Okay.
The third one I thought of is feeding your microbiome.
Oh, yes, I
So
was hoping
yeah.
we went there.
Yes. So our microbiome plays a huge role on not only our, like, digestive system, but, like, our brain, our nervous system. We think about how much our nervous system impacts our brain, but it's vice versa too. Our microbiome impacts our nervous system, impacts our ability to you know, metabolize, all of our, like, neurotransmitters, our serotonin, our GABA, and so really feeding the microbiome, and I can get into that, impacts moods, it impacts our nervous system, our cognition, behavior, it can even mitigate conditions like depression and anxiety, and so when we're really looking at that, like, gut-brain connection, we have to dive into the microbiome, right? And so feeding it, it's like, what does that even mean? The first thing that comes to most people's mind is like popping a probiotic. Sure, that can be helpful, but really to modulate your microbiome or encourage growth, new growth, you need diversity. And so, really trying to focus on not eating the same foods every day. A simple goal you can do is try to get 50 different plants in every week. And it might sound like a lot, but it's not if you're doing like herbs and spices and all of that. So, eating different foods, eating every color of the rainbow, lots of plant fibers, all of that is going to feed your microbiome a lot more than a probiotic. And so, yeah, that's my third one. It's like, how can we encourage diversity in the diet for
I love it. Thank you for bringing up the microbiome. I just read this crazy research about a test they did in Ireland, and I can maybe link this. And they tested people's stress response and what microbes were correlating with their like their ability to turn off their stress response.
wow.
And it was wild. They came down to specific microbes in your gut. So we want the stress response up, and then we want it to come back down to baseline where we can rest and digest and repair. And the microbes in our gut directly contribute to our ability to come back into rest and digest. So that blew my mind. I'm so happy you brought that up. I think your tips are so powerful.
Yeah,
colorful
huge,
foods,
colorful, diverse,
diversity. Mhm.
lots of
Brilliant.
plants.
That will help both. That's like compounding, right? Because that will help improve your stress response
Yeah.
and vice versa, help you digest your food better and process everything better so you have less of a stress response. So
Yeah,
brilliant.
and more nutrition,
And more
right? Just giving
nutrition and
diversity.
better
So it's like
everything.
I'm all about like how can you like stack things that are simple, but have the most impact. And oftentimes it's the simple things that do go the farthest, right?
And these are things that will help people no matter really what their symptoms are. If your symptoms are hormone related, joint pain, skin issues, acute digestive problems, brain fog, right? I mean, these are so upstream of so many issues. So
Yeah.
thank you.
Yeah, of course.
Yes. Um, anything else you want to finish with? I mean, you've given us so many pearls.
I mean, I think that it's important for people to realize that stress and fear of food might be the biggest risk factor for food sensitivities,
Mm,
even more so than the food itself. We often want to blame food for food sensitivities, which would make sense, but oftentimes it's that north to south process. It's not being in a relaxed state or eating under stress that can cause a food sensitivity. And so if you think about what is happening in your body when you are under stress. It's your immune system is looking for the threat. If your nervous system is saying like, hey, this is something, I'm not safe. There's something out there that doesn't make me feel like I am in a safe environment. Your immune system is looking for some type of lack of safety, right? It's looking for a threat. And so if we are putting food into our digestive tract where over 70% of our immune system is, while our nervous system is out there saying that it's looking for a threat, your body might start tagging food as a threat. And so I think that that's often neglected, even when people are struggling with a lot of food sensitivities or do a food sensitivity test. They eliminate all of these good, healthy foods without addressing that nervous system component. And ultimately, the goal is an expansive diet, not a limited one. Complete the boundary of our digestive tract. We really like lose that integrity with stress itself. It can deplete it. Um, and so you always just have to ask yourself if you are someone who is struggling with a lot of food sensitivities or maybe a lot of allergies where there's just this boundary breakdown between you and your environment. It's like, where else in your life are there boundary issues? It's like, are you overgiving? Are is your boundary too loose in your life to where you give at the expense of yourself? Or is your boundary too firm? It's like, are you too hyper vigilant where maybe there's trust issues and, um, you know, everywhere you look, you're looking for a threat. And so it's really important to kind of go there when you're working with root cause medicine, this impact that, our mind and our body are completely connected. And so oftentimes when we're swimming upstream, we have to go there too, right?
Yeah, I love that. And maybe one day you can come back and talk about that because
Yeah.
there's so much there and it's so brilliant. But what you just did there at the end was kind of beautifully take it back to where we started, which is our digestive system is the intersection between our world and our body, and how our boundaries are make all the difference.
Yeah.
And if we look upstream of that, we get our nervous system.
Yep.
So really great points, Brianna. Thank you so much for your
Of
brilliance
course.
and your wisdom and your calmness and all of that. I really appreciate it.
Anytime. This was fun.
Yeah. Thanks, Brianna.
Bye. Thanks, Janelle.